We want to start off with a reminder that we are not doctors. Before you make any changes or try something new, always consult with your doctor and medical team first. Chronic illness can vary from patient to patient, so it's always best to consult with your own doctor for what is best for you.
Hello and welcome to I Be Determined. I'm your host, Mason Harvey, and I speak from the role of a patient, and I have Crohn's disease.
And I'm your other host, Michelle Harvey, and I'm Mason's mom, and I also speak in the role of a caregiver. And today we're going to kind of conclude what we were talking about last week and let you guys know how everything worked out with our appeals for Mason's treatment. We are looking fairly happy. So,
But that's just a trick, you.
yeah, yeah.
Yeah.
And so, we're going to discuss that. But I think we also wanted to do something where we really want Congress to hear this. We have had a lot of people mention that this would be a great thing for us to do, to speak about, to testify about, what he's gone through, because it's not just Mason, it's so many people.
It's a lot more people than just us.
Yeah. And, the main thing is to let doctors make decisions for their patients. Simple as that. And I'm really hoping, somebody will listen to this that may have a connection. And even if you don't, maybe you're going to learn something and you'll feel compelled to speak out as well.
Yeah, and help.
And
Be an advocate.
yeah. So, we have reached out to a U.S. representative and to see if they can help, but I'll go there in a minute. I kind of want to see do you have any updates or anything you want to talk about before we get started on all the important stuff
I'm
here?
16 now.
Yeah. You had a birthday?
Yeah, happy birthday. Yeah, congratulations
birthday.
to that.
Got a 3D printer.
Yeah, I got a 3D printer.
Yeah,
Out of
thank you,
state.
Grandma and
Yeah,
Grandpa.
thank you, Grandma and Grandpa. I got a 3D printer. Already printing some cool things with it. Have some plans for other things too.
Yeah.
Got to stay at Disneyland
Yeah, we
for a
did.
night at the Grand Californian.
Yeah.
Very cool. Gonna be done with school in a few weeks.
Yeah.
Yeah. College is still painfully on the grind, but we're almost done with it. 3 more weeks, I think. Yeah, but it's gonna be a fun 3 weeks.
Yeah.
A little
Well,
painful 3 weeks, I guess.
counting down. I mean, and this is going to be it for your high school career.
Mhm.
So that's the good news. Then on to college.
Yep.
So we have, he's entered, hoping to get 3 different scholarships, or not. I mean, it'd be great to get all 3, but I think we're even happy just to even get one.
Yeah, that would be good.
I don't, I don't know the chances, but we figure you gotta try because your chance is definitely 0 if you don't try. So
You don't know until you try.
right, you have a chance.
Yeah.
So that's a good thing.
So good.
And so I guess one of the important announcements we're gonna have today is that, we won when it came to Mason's treatment.
Yeah, treatment battle.
Yeah.
Treatment between doctor and insurance for some reason.
Yeah. And pharmacy. Like,
Pharmacy,
but
yeah.
everyone's
Pharmacy just decided to
confused.
jump in.
I mean, it was like you talk to the pharmacy and like, oh, it's insurance making us do this. But it's
The
like,
doctor's just like, he needs it. And pharmacy's like,
Yeah.
it's insurance. And insurance is like, it's pharmacy.
Right?
And insurance is like, no, it's you. And pharmacy's like, no, it's you.
Yeah. Basically, it felt like a lot of finger pointing. We were going in circles. And, ultimately, the good news is we won
Yep. So
this round.
that's good news. But
Yeah.
there definitely, every year there's a war with
There's always
insurance,
more. You
so-
know that. Yeah, it doesn't, especially when you're on 2 biologics, it's twice the amount of fights sometimes. And so
fun.
basically we had 2 appeals that we had asked for Mason to please stay on his current treatment and not make a switch as requested by the pharmacy and insurance.
Not the doctor.
Yeah, and the doctor, because the doctor opposed it. This wasn't something that she was okay with either.
Now, if the doctor was okay with it, it would make sense. But when the doctor says no, they need to stay on this. Okay, well, insurance just says, well, that goes over my head. The doctor does not know.
Yeah, well, they know that the doctor knows, but what they care about is money. And
They
yeah,
pretend like they don't know.
yeah, so they'd rather just, just that, and that's the problem. You have, humanity and you have financials. That's where this kind of comes down to.
At the end of the day,
So-
you need both.
Yeah,
You
which
can't
makes
run
sense.
a world without either. You need
It does. It's true.
a
It's
monetary
true.
system, you need money, but without humanity, you wouldn't have any of those things.
Right.
So
it
goes hand in hand.
And we're going to probably talk more about that towards the end of the podcast because that's something that's very important to discuss in all of this. And, because we're going to reach a resolution or try to, we have to look at both sides and you have to look at what both challenges are facing because it's easy just to be mad at insurance. But the idea is to find a resolution, and too many people focus on being angry at one and just going after that. And it's like, well, what if we can work together?
Yeah, if you're just gonna be angry, you're just burning bridges. You're not gonna get anything done by just being angry. I mean, while it's hard to not be angry,
can give you motivation.
Yeah, being angry can give you motivation. You can't just say, I'm angry at insurance, so that's not gonna do anything. You actually have to have things to back it up. You have to stay calm.
Which is why it's important to consider both sides. If you only look at one side to argue your point, you're going to miss where they're going to argue back.
That's a bias.
So exactly. It's important. So it's important to hear both sides.
All your points.
And so we basically, after the 2 appeals, were both denied. We thought we were going to be doing a peer-to-peer. That's usually the next step. But in this case, we could not. My husband, he works for Costco, but he's part of a union through Costco. And because of that, we could not do a peer-to-peer. We had to do an IRO, which is like an external review. And the scary part with that was that the outcome would be binding. If we had to agree to whatever it was. And, because it was at a federal level. This went to a federal level. This was not state. It was at a federal level. And, we were nervous because if they didn't listen to us before, we were like, well, are they going to listen to us now? But what they do at the external review is they brought in somebody who didn't have interest in either party. They were a pediatric GI, and they agreed with us. Everything we had been arguing, they agreed. And so they overturned the denials to our appeals.
Can't really say no to that.
No, they can't. No. This was binding between both of us. And so the approval, though, was for 1 year. So we know the victory is, so short-lived.
Insurance will think, well, when's that 1 year's over? Oh, they're going to come right back.
And, but this is where we're talking about that anger to motivate you. And, staying silent until there's another problem is not going to help. And I mean, we're tired. We got a lot going on. We're not just, we have lives, we have work, we have, school, all that stuff.
College.
But this problem exists, and it's just for us right now, it's temporarily over. But for someone else, they're going through it right now. Someone else is being forced to start a biosimilar. It's And
the crazy thing is, there's actually a lot of people, and they don't even know it. You're gonna have a few people who actually decide, you know what, this doesn't sound right. We're gonna try to fight for what's right. And then you have a bunch of people who see, oh, insurance says I'm going on this. If they said I can, then the doctors must have agreed to that.
It must be okay.
And they don't even know. They don't even know what insurance just
They don't know their rights. They don't know.
And they don't know what the difference is between
And I wonder how many people actually research what they are going to be putting them on. And that's the other thing. And so we want to keep working on something that will prevent this from happening because, and I think that it's important to not just say, well, we won, we're good. And, sometimes you have to, depending how far you can take it. But we are going to be looking at options because I think, like we mentioned earlier, this is not something that should be settled at a state level. Because if to me, nobody should be forced to live in a state for health purposes. They cannot move out of the state because something is different in another state. I mean, this is the United States of America.
Yeah, where's the rights, huh?
Right. They should offer equal patient access rights to every citizen, regardless of their location.
Yeah.
So it shouldn't be like, well, yeah, you're a citizen of the United States, but you live in California.
It shouldn't be state level. It should be federal.
Yeah. So, I mean, and maybe we'll have to start at state depending where this goes. But personally, both of us, we don't agree with that. It needs to be something that is at a federal level so you can go anywhere in the United States and know that you are protected as you should be. This is not, this is like basic human rights.
Yeah.
This isn't something that we're asking.
Take the biologic that keeps you alive instead of insurance saying that.
Right. And so, we have helped pass a law before in our state for the Restroom Access Act. I do wish that was at a federal level as well.
Mhm.
However, there were so many states that had already enacted it. That was the path to follow because there
Mhm.
was so many at that
You
point.
know, you got to start somewhere. If you
Yeah,
can't start big, start somewhere, and
right,
then it will get bigger, hopefully, over time.
right.
But you can't just, I mean, some cases you can start big, you know, and that's
Mhm.
great. Congratulations.
Yeah,
And hopefully that's what can happen.
right. And it's kind of the plan here is we're going to kind of just start small with what we can do and hopefully maybe take this further. And so that's why I mentioned earlier we reached out to a U.S. representative because we've met with senators and assembly members prior to this to do the state law. But on a federal level, we need to contact U.S. representatives, and we're trying to find out if there's any current cases that are active that support what we are going to discuss here today and how we can support that, how we can lend our voices to that. I'm sure you want to speak in front of Congress.
Oh,
I think
definitely,
you
definitely.
definitely would. No
That's
problems over
definitely that's
here.
definitely a
It's a big
big shoes to
goal.
fill, but you know,
Yeah. But I mean,
definitely
you can do it.
possible,
I
yeah.
know you can. And I don't know if we'll quite get there, but you got to have a
Mhm.
goal. You got to have something to reach for, know what you're reaching for. So when you talk with a representative, you have a plan.
You
And
can't just say, "Oh, can
I'm
I talk
mad.
with you?" And they're like, "Oh, sure. What is it about?"
Right. Well,
I don't know.
I don't want to talk to a representative and be like,
Yeah.
I'm angry and this is what I'm mad
What
about.
are you angry
And
about?
have them say, well, what do you want me to do? I don't know. I'm just
You
so
you do something
right.
about
And
it.
I want to show them that,
Yeah.
look, I'm willing to help. I'm not
Mhm.
asking you
You have
to,
to take action yourself if you
yes,
want something done.
yes.
I
And
mean, other
so,
people can help,
mhm,
but if you want something done, if you really want something done, you have to put some work of yourself into it. You know, it's not
right,
just gonna
a
happen.
100%. And so that's why I want them to know that we're thinking on this. We're not just expecting them to take, do all of this, but I'm not sure if we'll get anyone to listen. I'm not sure if our local representative will listen. So I'll keep you guys updated, but that's what we're working on. And I think that you probably will, I mean, most of you out there know what step therapy is if you have IBD. Basically, though, real quick, step therapy is something that is insurance driven. So
Mhm.
this isn't a patient driven initiative. This isn't a medical doctor driven. This is insurance
Insurance.
driven. So when you're dealing with medical decisions that affect a human's quality of life and survival, should the decisions be doctor patient driven or insurance driven? Because who's going to
Yeah.
care more about the human, who's going to care more about the money. So the goal with what we would like to do is eliminate step therapy,
Hmm.
and because it's
Yeah.
also known as fail first therapy. It's the one that asks you to fail
Fail, which is
something.
so nice when you're on something that's already working and
Yeah,
oh wow,
we want to
you're
take you
doing
off of
great,
that.
but we want you to fail
Yeah,
because
and
that makes logical sense
we were
to our bank
correct.
account.
I want to point out we were correct because we had mentioned that this biosimilar they wanted him on, there were no clinical trials for pediatrics. There was nothing to support it. And the other doctor agreed. That was part of the reason it was overturned. How many people do you think
Don't
realize when
know
they
that.
agreed to a biosimilar, it's not FDA approved
No.
for kids. It hasn't been clinically tested on these kids. And so these are should be very big decisions, but they don't tell you that part.
Mm,
So, I think the idea with asking patients to try something and fail something needs to be done away with.
definitely.
I think if your doctor wanted you to try and fail something before they give you
You
what they knew
you
would
would probably be
work,
very angry.
you would be like, well, why don't you just give me what works? Well, because that's expensive. We want you to try and fail this first.
And then who's gonna get blamed there? People are gonna be like, well, this doctor's
Right.
awful. You
Would you
know,
go
this
to that
doctor wants me
doctor?
to be hurt. No.
Right.
But when it's
No.
insurance,
Right.
get a free pass.
Yeah.
Get a free pass to just
Because
take money.
the best person, and with Dr. B, with your doctor, the best person that's going to know exactly what you need or what a patient needs
Is your
is your doctor.
doctor.
Probably not insurance.
No. I mean, insurance has, you know,
Their interests are
several.
slightly different. And
Yeah, they're more into money than
yeah, but I mean,
someone
I
else.
think there is a
Just
part of
you.
this with insurance where you can appeal to that financial side and show them the problem still that this is causing and costing them ultimately. It's still going to
Mhm.
cost them. If you fail something, you have a hospitalization.
Yeah.
So anyways,
Then they're paying how much for that
mhm,
hospitalization, you know, because they messed you up.
right.
Now
So
they're accountable.
I'm assuming that they do have some kind of calculations to show the ratio, but still part of it. So one of the things, and this is one of the things this is one of the things that his doctor had mentioned is, so ethics, that's a big deal when you're talking about medicine, you're talking about treating patients. And, ethics, in my opinion, is really called into question because insurance isn't making the best decision for the patient. They're making the best decision financially. So,
Mhm.
like in Mason's case, if with what they just asked us to do, basically, he's on a treatment that works. They wanted to put him on something and see if it worked. And if he failed it, then, maybe he can go back to it.
Maybe
So the ethics in that is they didn't make the best decision for Mason. They made the best decision for
for them.
themselves.
Hmm.
And insurance has something to gain, while doctors do not,
Don't.
and patients don't off of this
Well,
step
what they're
therapy.
trying to get out of it is to live, but
Right. Well, you don't have anything to gain off the step
no, you don't
therapy.
get anything out of step
No, but
therapy.
you do have a lot to gain by being on the correct medication
Yeah,
that a
you get your
doctor
life back,
says.
you get time back, and you get
Right.
to live your life back.
And so, the other thing is some people assume doctors get kickbacks or incentives, and I agree. I don't think our system that we're, at the children's hospital, they're not doing that. But I do think that, insurance is definitely getting something. And so that's what really needs to be investigated,
Mm.
in my opinion, is
Do you
the
want it to be
ethics
unbiased?
behind all this,
Uh-huh.
and especially with kids.
Yeah,
It's like,
it
I
shouldn't
mean,
be kids
it
and
adults
adults.
too,
No
but it's
one.
really awful with kids who are in a position where they can't defend themselves and they have to have caregivers or rely on
Yeah,
somebody else. As an adult, you can be your own voice, but for
yeah. Poor
kids,
kid. The kid, the
they
kid doesn't know
yeah,
what they're doing.
it's really messed up.
What does insurance mean? I have to fail this. I have to go on what sites to find all this information?
Yeah,
Heck, am I
you have to
what?
become an expert and
I have to become a
professional
freaking
and all these
scientist?
things. And so for this reason, insurance, they should not be a part of patient care. It's a conflict of
Hmm.
interest, in my opinion. It's a definite conflict of interest. And, you know, asking patients to try and fail less expensive medicine that a
Is
doctor is saying, I don't recommend this, my patient could catastrophically fail. And they're like, oh, that's okay. We
yeah.
still want to try it
Well,
anyways. Um,
that's cool. Thank you for telling me.
yeah,
But
it's like, no, no, this shouldn't be a thing. And even the
mhm.
stress on the patients and all these things. And so I get that cost is definitely an issue. Like, I
It
think
definitely
we
is
know that,
expensive. It's like
right?
$1 million a year.
Yeah. So that's,
Definitely is expensive. We can't blame them for not being happy that I'm
right.
on it, but
Which that's a whole different podcast.
yeah.
We could talk about, we could really go into that as well. Um, and so it's a problem and someone has to pay for it. And
Hmm.
but the bottom line of this podcast, what we're looking at right now is what is best for the patient and what is best for, with throwing out all the noise, throwing out the financial costs, at the very end of the day, what is the best for the patient, this human
Hmm.
being? And I don't know how to get there. That's something else to talk about because on another podcast. I don't have all the answers, but
No.
I think the biggest answer is you do treat humans with, decency, with kindness, and
Respect. Telling them
health.
not to fail something
Right. You don't set them up.
is like a punishment.
Right. So basically, our proposal is a simple one. It's just eliminate step therapy, right?
Hmm.
If and this sounds really easy, and I
Yeah.
don't know at what point, this I'd have to like another podcast, but I'd have to look up when step therapy came about, how
Hmm.
it came about, and look at those reasons because we need to understand the reasons it became a thing. I think to fight something, we need to understand why.
Yeah, we need to understand why. Because
Mhm. It
currently right
seems
now, this
like
seems like it's absolutely useless and there's
right,
no reason for it. But
right.
why was it made? There has to be some reason. There
Who
has to be a good
supported
reason.
this?
Yeah, who's the
Like
person that's like, you know what? It's a good idea to make someone fail something.
right, to save money.
Yeah,
And then let's cross our fingers and hope they don't. And I mean, cool if you don't, but why would anyone want to take that chance? Like,
yeah.
I wouldn't.
No, that
I
was
would
your
not.
kid. I'm pretty sure you
No,
wouldn't.
you would not. So, the simple thing here, get rid of step therapy.
Mhm.
And if a doctor prescribes a treatment, the patient gets the treatment.
Yeah.
That's
A
like,
doctor should be able, well, the doctor is and should be able to give
mhm,
a kid or any patient a
yep,
treatment because they did the research. They know that person more than insurance. I don't think
right.
the insurance ever did a colonoscopy,
Well,
but
even like insurance didn't even understand they had recommended all these different classes of drugs that, well,
mhm,
they said that Mason hadn't tried and failed. It was like 9
yeah,
drugs. And there were different classes. Like,
They're not the same kind.
no, and it's
They
like you
don't use the
can't.
same cells, the same
Right. So it's like
tactics.
this is like it's like apples and oranges. You
Hmm.
can't compare that and say he has what? It's like, but he's in this class of a biologic. Why would he need to like so anyways, confusing stuff, right?
It's like if someone has an iron deficiency and you're taking iron, right? Okay.
Hmm.
Uh, yay, my iron levels are coming back to normal. Well, trying
Yeah.
at least. And then insurance says, you know what? You gotta take um vitamin D. I
Right.
mean, okay, well, vitamin D will help with iron
But it's
input, but
right.
it's not iron.
Right. It's not the same
Hmm.
thing and
No,
not
it's
the
not the
same
same
way.
thing.
So
And it's not gonna help the
s-
same way.
so insurance really shouldn't have a say and
No.
they should not.
That kind of does sound messed up, but
Yeah, but they shouldn't.
when it's a doctor's orders
That's
and the
it.
doctor knows what's best,
That's
and the
it.
doctor did the research, insurance didn't,
And
it's like they shouldn't be able to
right.
change that.
And they should be like, okay, this doctor is going to keep this patient healthy, which is in turn going
Mhm.
to help our bottom line in the future here as far as surgeries go, as far as hospitalizations go. But
Because the thing is, apparently, if if doctors don't know what's right for a patient,
mhm,
and insurance knows what's right for a patient, apparently every single time, why do we have doctors in the first place? Why were
right.
hospitals created if insurance knows what's best? Because heck, I'm going to go on Zoom with my insurance provider and go, "Hey, I have these different symptoms. Do you know what disease I have?"
Right. They're like, we're gonna,
Yeah.
yeah, that would not feel safe. And
No.
that's essentially what is happening. And so, yeah, so insurance shouldn't have a say in the treatments and they can't override a doctor's decision or
Mhm.
change a prescription. You know, if a doctor chooses to start you on a biosimilar, that's one thing. But if you're on something that is working, we know like you don't rock that boat. You
No.
just you stay with it.
Lucky that you found something, so you might as well
That's the
stay
thing.
on
You're
them.
very lucky.
Hmm.
It's true. And so, yes, doctors should be held to a level of accountability here that
Hmm.
would prevent wasteful prescribing. But, we're not talking like I know there's an epidemic and problems with in the pain medication world. I know
Hmm.
there's stuff with that, but you know, I feel like there definitely would be a way to hold doctors accountable because in the Crohn's world, I'm pretty certain there's like a database, right? Or you could
Hmm.
have an easy database
Yeah, yeah.
proving that
That
these
it
biologics
needs this and this and
are
this.
right, they're necessary. You have all the medical documentation to treat this. It's not like you just made a phone call, said, "Hey, I've got a stomach ache," and like, "Hey, you should try Remicade or you should try Humira," or
Yeah,
"Oh,
yeah,
Stelara."
that because that's
That's
totally gonna
not,
help.
it usually takes a lot of work to get
Hmm.
this diagnosis. You've already been through all of that. Doctors would not be wastefully prescribing this stuff. They can't. And there should be something showing that these biologics are saving lives.
Hmm.
They're preventing hospitalizations,
Yeah,
preventing surgeries. They're preventing comorbidities, because there's a lot of offshoots of this disease when it's not controlled.
yeah,
Anemia, low
anemia,
bone density.
iron deficiency,
Um,
malnutrition, things
right.
like that. But another thing is to make sure a drug really works, like a biologic, of course,
Hmm.
it will take 3 months to
Yeah.
more, 9 months. It
Depending.
takes
Yeah.
quite a long time to make sure that biologic is working. And so for me, when I didn't take my Entyvio for 5 weeks because they were trying to see if I can make it to 6 weeks, that was only short by a week, and I went into a flare.
Hmm.
So if you want someone to try a new biologic and they're off the other one, and it's 3 months, 9 months, they're gonna be definitely in a flare,
Right.
because that's way past their treatment.
And it happens a lot when insurance doesn't approve something quickly enough or do so, it can mess up your treatment.
And it forces you to kind of say, all right, fine.
Right. And with that sort of thing, when that happens, it's hard for people to go to school, to go to work,
Hmm.
just to function. And so that's another aspect of this
Now
that
you're
would
losing
show
time.
it's not wasteful prescribing because you're helping these people feel better so, they can function outside of disability. They can work, they can excel at things and have a chance to regular life just like anybody. They should be given the same rights and that same
Yeah.
opportunity in America.
And then you're gonna go into a flare, or bad flare. Then you're gonna be hospitalized, and you're like, dude, please just let me go on the other one. Insurance is gonna go, oh man, I see that you're really sick right now, but there's still one that you haven't tried yet.
Yeah. And it's like, and again, it just seems
Uh,
like, really? So that's
seriously?
wasteful. You know,
Mhm.
that's
And now they're paying money for the hospital visit?
right. So that's the kind of wasteful things going on. It's beneficial for the patients, it's
Mhm.
beneficial for society to have healthy, engaged people in
Why
business
is there a
and
thing called healthy workforce where you
yeah,
want your workers to be healthy so you can produce more
right.
and you have, whatever the
So
graphs are called where it shows that you're producing the right amount. But then with everybody sick,
yeah.
I'm pretty sure it's not going to look as good, right?
And so that's the other, aspect that I would hope is being looked at here is that you're costing way more in the long run. It's affecting society on a whole another level. And I
Hmm.
don't think they're really thinking about that. It's like, oh, it's a sick person. Yeah, well, the sick person
It's only one sick
is
person,
right.
but when you start to
It's
do it to
millions,
everybody,
and we're because it's not just IBD. I know other people facing chronic disease are also going through these challenges.
mhm,
And so it's like, no, I think we should want these people as healthy as possible so they can be contributive members to
we
society.
we have these health problems that slow us down, and we're having a harder life.
Yeah.
But you still don't deserve that. You don't
Hmm.
deserve to feel better because you were born with a problem
Right. And you're too
that wasn't your
expensive.
fault.
So
Yeah,
yeah, it's
too
like,
expensive. Yeah, throw them out.
and and one of the other things, and I think this will probably end up being another podcast
Mhm.
in itself. But we kind of mentioned this the last 2 weeks ago when we talked with you guys, is why were we so concerned when insurance wanted to switch Mason from a biologic to a biosimilar? And I know some of you listening are probably thinking this shouldn't. Maybe they would have just taken it, accepted it. They would have been like, we wouldn't have fought, but you probably wouldn't have known to fight.
Mhm.
That's the thing.
Because I mean,
It's
if I wasn't as educated as I was about biologics and all these
if
different
we didn't
things,
do a
yeah,
podcast, you might not.
yeah, and if we didn't do a podcast, I'd assume that if it was just me, I'd kind of assume,
Yeah.
oh, they're gonna put me on this, so I assume that my doctor said, all right.
Well, and it also
Mm-hmm,
said in the letter that not to worry. This
mm-hmm.
is safe and effective. It's been
Yeah, okay,
proven.
that's safe and effective. Well, wait, oh yeah, it was proven?
Yeah,
Why are they saying it's
yeah,
safe and proven when it's not FDA approved for kids and it
right.
hasn't been tested on
And so that's
kids?
the thing. It's like maybe this letter you want to send to your adult population, but this letter is not
For
fitting
kids.
for pediatrics.
Even then, that's still messed up for adults. You don't want to
Right.
make
You
these
should
adults
still have a
fail.
choice. And
Yeah.
because and
Being
this
a kid doesn't give you more rights than being an adult.
no, and this is something that affects both of you guys. And so I might have this wrong, and this is something I want to research more and do another podcast on. But the clinical studies that they're using to get these biosimilars approved,
Hmm.
they're not, from what I could find, they're not conducting studies on all the conditions that the biosimilar covers.
Hmm.
Okay, so
Interesting.
with the two they recommend with Mason, because I went to the clinical trials for these and I studied these. And again, we should not be having to do all this, but this was important to me. I wanted to look at it because it's like, all right, they say, why is the FDA saying one thing and they're saying this? And so one of the biosimilars that they recommended had a clinical study of 509 patients.
500.
509. That's it.
509. Hmm.
That's it.
And
And do
how
you know
many
what they
people
had?
out there?
Do you know how many of those had Crohn's disease?
How?
None.
Oh.
That was just for
What?
plaque psoriasis. And so
They're treating something else and they're saying, oh, Crohn's people should take this.
because they concluded based on this trial with 509 patients with plaque psoriasis
Hmm.
that because it was using ustekinumab, which is the active ingredient in Stelara, that they could just, it looked like to me, and again, I could be incorrect.
Could
So,
be.
do your own
Take
research.
this with a grain of salt.
But what it appeared, because I compared it to other studies, I looked at multiple ones. So the phase, like whatever was phase 3, whatever they call it, whatever their trial was, they would give you like an exact amount, like 509 patients. The other one, it was like a different number, like 288, 388, something like that.
Hmm.
And but the stuff when it came to Crohn's and talking about the clinical states all was identical groups, identical wording. So it
Hmm.
looks like once they only have to do one group for the trials, and if that works and it's using the active ingredient, they say it'll work for everybody.
Which
So
that shouldn't be that should not be how it
no.
works.
And
Just guessing
and so I'm
because it has something in it.
like I don't want to like start something without like knowing for sure.
Mhm.
And so this is
You know, you
just
don't know for
again,
sure,
this
but
is what, and I use this. I use this because I also submitted, a 2-page document to the external review to let them know my findings and explain. So I did use this
Mhm.
in my argument, and I did put that in there with links, with showing them what I found. And
Mhm.
so I think that's for another podcast to discuss, about biosimilars so people know and understand that when they say these have gone through, you think these have gone through testing,
Mhm. And they're safe
it's
and proven effective.
right. Much less is required of these than the initial, I guess the brand name drug.
Mhm.
So,
Now they didn't
um,
say, I guess this is effective. They said
it
it's
is.
proven.
And so that's what it's kind of unsettling that you feel like data can be kind of
And
manipulated.
kind of be lied about, you
Right.
know?
And then insurance can say something like, "Oh, it's just as safe and effective for Mason," in a direct contradiction with the FDA, who
Hmm.
says the safety and effectiveness of both of those drugs that they're recommending
Insurance is
have not been established in pediatric patients with Crohn's disease or ulcerative colitis.
insurance really disrespecting the FDA right there.
It's like, wait, so I'm reading two conflicting reports. And, but again, I don't, more on that later because I think that transparency and honesty is something that should be shown to consumers and patients. And I think those kind of things, they need to be honest exactly with and not in a way where you have to, because reading through the clinical trials, you have to find the number that was assigned to the particular drug. You can't just go in there and type in the name. It's not just going to
No.
come up. You
You
have
have
to
to
look up
find
this,
the number, the ID
right.
for it,
And
basically.
then you have to read through these things. And it should just be something that they tell you, this is how many people we tested for, and with this it was not tested on this group, but they need to be honest. And maybe I didn't find something because again, like I said, I should probably not be reading those documents. I
No.
don't know how qualified I am, but I did because I was frustrated. And I was
And
like
here we
trying to find
are.
answers.
And see, we wouldn't have been so frustrated if insurance hadn't done this. So
Right. And
I blame you.
which kind of leads me to the next point, uh, that no parent, no child, no adult, no patient should have to become an expert at pharmacy law, FDA documents, understanding clinical trials,
What was that?
reading between medical lines, and spending hours calling in circles between insurance, the health solutions end of it, pharmacy, and your doctor should not have to spend these multiple hours that are extremely precious where they could be treating
Something
another
else
patient.
and helping them, saving a
Right.
life.
Help. Yeah, that's what they should be
Insurance
doing.
bats an eye to that. The other kids costing money.
So we are concerned about the parents who receive a letter from insurance and trust it, like we
Mhm.
mentioned, and go, okay.
Okay, well, if insurance
Um,
said so,
right.
we trust insurance. They must have talked to our doctor,
Well,
right?
especially when they quote things
They,
and say something is safe and effective. And then sometimes you have, an overworked doctor who has too many patients, is exhausted, and doesn't have or want to take the time to appeal
Mhm. And
multiple
they're just gonna go, okay, go ahead.
cases. They have to write all these letters and do all
Yeah.
this stuff.
And then they are missing time on everything
So some
else.
doctors might just say the biosimilar's fine because you know
And
what?
that's how insurance gets their way.
Yes, and that's what they're used to. And in a lot of cases, not to scare anybody, because the biosimilar may be just
Hmm.
fine. That's the thing. Like we're just talking about. I don't care if there's that 1%
Yeah.
risk that it's not.
The
I
thing
don't do
is,
that.
a biosimilar might work. Insurance got its way. You are doing fine on this biosimilar. It's cheaper. Cool. The thing is, a biologic doesn't last forever. It's not like it's gonna help you
Yeah, in most
for,
cases. In most
well,
cases,
yeah,
yeah.
in most cases, it's not gonna last forever.
Hmm.
But if something's already working, I mean, I can understand if someone is trying this, trying this, trying this, it's all not working. Insurance goes, try this. Okay, sure.
Hmm.
But if you have something that is working and it's gonna last 20 years or maybe a little bit longer, it's not gonna last forever. You want to stay on that as long as you want, but then they tell you to go off of it. Now there's a chance of building antibodies. And so you have to fail something else to go back to it. By the time I go back to it, it might have antibodies. I might have built up antibodies to it, and I may not be able to go back on it.
Right. I mean, they say it's the same active ingredient, which is ustekinumab. So technically, they're saying
Mhm.
you shouldn't, but technically, there's a chance any of these things could happen.
Technically, there's a chance.
Right. And
Technically, we're not saying.
we're not, a doctor might be listening to this and disagreeing with this.
Yeah,
A scientist might disagree with this and say, well, no, it's the same active thing. You're not going to build up antibodies.
opinion,
That's
and maybe
okay.
have more proof to back that up.
Right. But when we're not sure about how this
I
works
mean,
with.
we're not even doctors. And what did it say? We're not supposed to be medical experts
Right.
to help
Right.
support why
No.
I need it. But no, here we are on
But
this
it's like
podcast.
Mason's basically saying you don't want to take a risk
No,
at creating that antibody or creating a chance where you can't go back on your original
because
one.
now you just wasted a biologic.
Right. So it's better to just exhaust what you're currently on and then
Hmm.
make decisions based on that afterwards, in our opinion. That's
Yeah,
what,
that's our opinion.
and so kind of back to step therapy, because I think we could keep going on. We'll say that for another podcast. But I'm guessing that the time and waste that even goes into this whole step therapy thing is like probably in the billions. It could be millions, but this is my guess. I don't have any basis for this, but it just seems to me that the financial costs alone for a failing patient would be staggering.
Mhm.
And if people are failing and they're getting sick and causing damage that's going to require future surgery, it might cost them work
Yeah, you're
time.
losing intestines,
Um,
perhaps.
yeah, you're going to lose, and
And
you
do you
don't get
want to remind how much? Do you want to remind insurance how much a hospitalization is again?
right. And having the loss of a body part,
Mhm.
isn't something that anybody should have to be faced with
No.
because insurance wanted to, be a guinea pig and like, let's see what
Insurance is like,
happens to
well,
you
that was
on
your
this.
fault. You didn't react to it.
Right. And so I mean there's multiple ways that the cost to this could be very expensive to me. And then, just the back and forth and the people are required, hiring people for external reviews and the cost for appealing and all this, like this all was because of step therapy. There's also the mental health
Hmm.
that
Emotionally draining.
right, that needs to be factored in. Anxiety, stress, and therapy is now going to be needed. And not only for patients, for caregivers too, and for the kids. It's excruciating to go through this kind of thing. And it's like, and to me, it's like all this could be avoided if when the doctor said, my patient needs this, you get them what they need, you put them on it, you avoid a flare, you get them out of a flare, you do it. Hey,
Help them.
so it's
Yeah.
just like this endless loop that we're currently in, which is, arguing between the doctors, the patients, caregivers, insurance. It just costs people in multiple ways.
Mhm.
And, there to insurance, it's like, oh, we're going to save some money, but a price is paid. And that's usually paid by the patient,
Yeah, paid by the patient,
Right.
Yeah.
Unfortunately, because it's not just the financial cost we're looking at. So,
Yeah, what's more costly, the financial cost or a life,
mhm.
And I feel like just the thing that I don't like. I feel like the two things I just take out of this is, I mean, there's all this stuff behind it, but there's two things that I don't like, and it's step therapy. Yeah, they shouldn't be able to do that, and insurance should just not be able to override a doctor's orders.
Right. Simple as that, guys. That's
Hmm.
all we're asking. Like, if we can get Congress to listen to us and let us
Yeah.
decide, like, that's what we're asking. Don't override the doctors. Let the doctor make the decision.
The
Done.
doctor is the one doing the
Right.
checking your health and
And,
stuff. Insurance could care. Insurance doesn't know.
they're just, it's like the bottom line is money. And to be fair,
Mhm.
for
Who
most
doesn't
people,
like
these
money?
are FDA approved.
Mhm.
Not for pediatrics yet,
No.
but neither is the other. It's a whole mess. So
Yeah.
this is definitely way more complicated. We're on a very surface level here. The thing is, insurance isn't requesting you put, people onto something that's like somebody made in their backyard and is,
Yeah, you should just try this rickety old
yeah.
whatever
It's
this
not
is.
like
I
I'm
don't
just
know what
like
it
buying
is.
these, like, it's not like just like, yeah.
Yeah, because the
So
thing is, I
they,
guess I guess what puts insurance more in the wrong, I guess, is, I mean, I'm on to biologics. They're not FDA approved for kids, but they're working.
and there
And
is data to
but
show,
there is data to show for kids,
right?
you know. Um, but what puts insurance in the wrong, I think, is them saying that it's proven safe and effective. It wasn't like for these ones they said it's actually safe. No, it's there's tests showing, but it's not
Mhm.
totally
There's
approved.
no clinical trials
Yeah,
for you
no
guys.
clinical trial. But when they say it's proven safe and effective, and you
Mhm.
go, oh, it is?
Like if you just read that letter and
Mhm.
moved on,
Yeah, but it actually isn't. So I
right?
feel like when they lie about something like that, that puts you in more trouble.
Yeah.
You shouldn't lie like that
And so,
than ignoring a doctor's orders.
right. And apparently
Insurance is
that is what
interesting.
they try to get away with.
Yeah.
I get it. Like we mentioned, insurance is looking for cost effective ways. treat their patients. And so the financial side of me understands that. I mean, we can understand that.
Yeah.
Everyone's always budgeting, so it makes sense that insurance would budget too. And these treatments are expensive. Insurance is not going to like them. Like
No.
Mason mentioned, it's over $1 million a year because, one of his injections, I looked at it before, it had a $35,000 price tag on it. And then his infusions are in the $43,000 range. That's not the cost of biologic, but that's the cost to infuse it chemotherapy process. At face value, that's around $78,000 every 4 weeks, which is over $1 million a year. The thing is, insurance does negotiate a lower rate. So we're seeing that number and they are getting a percentage of, they're not paying that full amount, but it still is expensive. So it doesn't matter. They would still love to get that number
a little bit lower,
even
because
lower.
who wouldn't?
Right. I'd like to see a future where insurance isn't, I guess, also being charged exorbitant amounts for these treatments. I'd like to see where the negotiated amounts, things are, that's where it starts. And maybe pharma can help out instead of offering us copay programs, offer those copay programs with work with insurance. Don't make, because it's like also like this big mess, and we deal with this all the time. It's the other thing we've been fighting with Entyvio, their CarePath program. They give us they give us money, so with our insurance doesn't, cover the Entyvio portion of that's out of pocket for us. Entyvio has a CarePath program where they pay the difference. Well, this mess, okay, is like ridiculous. So it's like every January this happens because we're just starting fresh with our health care. And so everything's starting fresh. All the numbers are back to zero. Oh, so then we get a bill from Rady saying you owe $1,800 or whatever it is, roughly. Okay, it's probably like a little bit less than that, but roughly we're just saying 1,800. And so Rady's will say you owe 1,800, and we're like, you guys, there is on, it shows right there, there is a program you have to submit the paperwork to. And then they submit the paperwork, and then we get another bill from Rady saying, you owe us $1,800. And we call Rady's, and Rady's like, oh, yeah, we sent it, but it didn't get paid. And it's like, okay, all right, so what? So then we call,
for you to learn.
we call the CarePath program, and they're like, oh yeah, and Rady's also sent them the wrong thing, which is for another. That was the other fun thing. And so again, this is our day will be going along. This is all of a sudden stopped with all these phone calls, and this takes hours to get.
And we still have school. My dad still has work. I still have college. She still works.
Yeah, and it's like, no, this is what we want to do today.
Yeah,
really.
It's a day off. Congratulations.
And so then we have to call Rady's back and have Rady's give us an itemized statement. And then they need an EOB from our insurance for the CarePath program. So then we have to go with our insurance and download an EOB. And then they don't accept emails with this paperwork. You have to fax it, and you have to download a program and fax from your computer because we don't have a fax machine anymore. And
who has them?
So all of this, and it's like, okay, it really, if we didn't have to be involved as the middleman, they could just, insurance would just go to the CarePath program. Like they work together, the pharma and the insurance, and they work these numbers and they make it happen. So we don't ever have to see any of it, and we don't have to go through it. Make it simple. Work together and maybe negotiate something. I don't know, but I do know Big Pharma does charge a lot. We also, like, actually, it's one of the things we did. We went to Mirador Therapeutics, and we went to their ribbon cutting in San Diego. And so we get invited to these. We've been invited to biotech companies. And I think the important takeaway is I don't feel that they're necessarily overcharging, because I am seeing what they have to
put
do
into it.
Yes, there's a lot of risk, and a lot of this capital that's they're coming up with to fund this research is from investors. The government's not like, how can we help you? They're having to find,
figure that out. I'm gonna go.
Mirador came up with, it was $400 million that they have investors to start this initiative, and that's hard to do. And so I understand that they have years invested into getting something approved, and you got to hope by the time you go to get approved, someone else wasn't already working on this and they beat you to it. And so how many millions?
What would you lose?
It's so there's risk. There is, they want to attract top talent. So there's a lot that goes into that because they want the top scientists, they want the top doctors, they want the executive teams that are going to create the next best thing. And so you kind of have a stalemate where you have these companies that need to invest and spend a
Yeah.
lot to come up with it.
Who's really at blame, you know?
Right. So it's like, so I know I don't have the answers because I'm like, okay, well, I can see where they have to charge a lot.
Mhm.
Insurance can't afford this all the time for so what can be done there? That's a whole different.
Yeah, because I get upset. I'm like, why does insurance think they can tell me oh, you can't take that. You have to take this. And I'm
Mhm.
going, oh, well, you're really evil. And they're going, man, I'm suffering over here. Look at what I have to pay. And I'm going,
Right.
oh, well, that's really bad. You have to pay $1 million a year. And oh, and then I'm going, well, it must be the biologics fault for costing so much. I'm like, well, look at what goes behind it.
And
So
I
who's at
think
fault?
a lot of people get angry at insurance and big pharma. It's like a
Mhm.
big they're always blaming, but I think the bigger problem is nobody tries to solve it. Everybody
Yeah,
points fingers, everybody acts like they're the bad guys. And it's
yeah,
like they are saving lives too, guys.
they
Like
are. They are.
I'm not like I understand our insurance without it. Could we have afforded the care for Mason?
Definitely not.
No. So insurance isn't it's
So
not
you
all
still have to be
bad.
thankful.
Right. It's like
It's not completely bad, you know. They're still helping. Sometimes a little. They don't help as much as you
we
need.
need to figure out a balance, and that's the important thing. And then there's like nonprofits like the Crohn's and Colitis Foundation, and they're doing what they can to help support research, and that relies on all of us fundraising and reaching out to the community and saying help us so we can raise money for research because
That's
there's
more
not
like
enough from the government coming into. I mean, and to be fair, there's a lot of chronic illnesses and diseases out there, and they all do deserve equal attention.
and how many other diseases are there? And if the government's helping pay for
It
Crohn's
gets
disease,
that's a problem too.
then all these other diseases, there's millions of them. They can be like,
But
what about me?
I think a lot of these can almost be combined though in research with
Hmm.
autoimmune. There's
You put
ways,
it into groups.
it's a very complicated thing that way bigger than our podcast.
Oh my God.
Again, way more than we're
Yeah,
qualified
yeah,
to
you just
speak
said
about.
that.
But I think it's just important to look at, that we acknowledge we don't know how to fix this. That's not what we're saying, but we'd love to be a part of helping figure that
Yeah.
out. And that doesn't mean just because you don't know how to do something, you just give up and you say, well, it seems hopeless. No, there's got to be some answers because right now, the bad part of this is ending up with the patients and it should not be on the patients. And
No.
there should just be more care and more time being put into figuring out a solution that works for everyone, but most of all for the patient. It's put a patient first.
Patient is the one suffering in the first place because they got a
Right.
disease.
They need to come first. And you make sure they have what they need and then you guys figure it out. But you guys don't say, we haven't figured any of this out, so we're going to put it on to you now. And it's like, that's not
Yay.
how it should be. You take care of your people. Seems so wrong with what they're doing right now. It seems backwards. Something needs
It
to be
does.
figured out. So yeah, instead of looking at a teen like Mason, a kid, adult, someone with Crohn's disease is like a financial number. They need to
Mhm.
be viewed first
It's a
as
human. It's a
human.
human.
Yeah,
It's not just a number. It's not
right.
just a price
Which is
tag.
what you are in a database with
Yeah.
the insurance. And they're not looking at Mason Harvey, the kid who's doing this and trying to
No.
grow in height and trying to graduate. And they're not looking at any of that. They're just looking at Mason Harvey. He costs us this much. We could save some money by doing this. And that's where there's a problem. And so basically what we would like though, bottom line, let doctors make
Be
the
able
decisions
to.
for their patients. Right?
The doctors know best. Let the doctors do their thing.
Let the doctors do their work. Let them do it and see maybe how much this will actually save society and save people. And that I think would be
And if people will
amazing.
actually improve.
Yeah. So that's kind of it. Hopefully, you guys learned something from our ramblings and
Hopefully you didn't
talks
just
here.
fall asleep 20 minutes in.
Yeah, but hopefully you guys have learned something. Share your stories, what you've encountered with insurance, and we'd like to hear that too. And just know we're not going to give up here.
No.
This is we're going to try to do whatever we can
Definitely.
to help you guys out there too. So
Helping is what we do.
yeah, I mean that's why we do this podcast.
Yeah.
It's not
That's why
just
we
because we
started
like
them.
to hear ourselves
just-
talk.
It's not just because we like looking at a camera and going, we love just talking to these microphones.
It's writing, coming up with episodes. It's like writing a research paper every couple weeks. So sometimes we're able to turn these into projects for him he can use at school
And then
too.
you write them for him. Oh,
Right.
Cool. So now it's two for one.
So it's a lot, but it's worth it if we feel like we're making a difference for even one listener if we're doing because it's just important to us. You guys are important to us,
Yes, you
and So anyways, if you guys want to see more about us, see us at Mirador and what we got to do, see us our Disneyland pictures.
Oh, yes,
Disneyland. Yeah, you can follow us at Team IB Determined on
really Instagram. Do
that. Follow the Reggie Project, and if you catch up on our Reggie Project, it was just a few weeks ago. Probably about a month ago now. We talked about that. So go ahead and do that. Yeah. And you guys can listen to us on any podcast stations like Spotify, iHeartRadio, Amazon Music, Apple Podcasts, and we have a link to Buzzsprout so you can see all the stations. And if you prefer watching.
Because if you love watching, you should go to YouTube because there's also podcasts on YouTube if you want to listen on YouTube, that's cool too. But if you want to watch us too, there's also YouTube videos where you can watch us and hear us. And if you are on YouTube, make sure to like and subscribe. And if you want to be notified every time we post a new video, make sure to hit that bell icon. And please leave comments because we love getting comments. If there's something we missed today, please tell us.
Or something we can talk about.
That's
important to you. Yeah.
What brought you to this podcast? Are you having insurance struggles? Because we love to hear about them.
And if you want to recommend anybody we could contact, if you have an idea and you're like, I'm not sure, we'll do it for you. So you don't have to do it.
If you have an idea, tell us.
Let us know if there's something, send us a message. Let us know if there's somebody you think we should contact. If you know of somebody working on this that we could approach, we're happy to do it and help you guys out. So with that, everyone, we hope you guys have a good weekend, work week, vacation week, whatever you're doing.
Win your insurance battle.
Yeah, we hope you're winning insurance battles
maybe
out
they'll
there.
be watching us by the time they're in summer break if they're in school, which I don't know.
Yeah,
maybe watching this while you're in school, but okay.
Well, maybe I hope people listen to us year round.
Yeah.
I do hope so.
That'd be good.
Yeah. So anyways, guys, hope all you're doing well out there. Keep listening. We'll be back in a few weeks with our next episode.
Yep. Stay strong.
All right. Talk to you later.
See you later.
Bye.
Bye.
We hope you will stick around, tune in, and reach out to us with your own journeys. We are excited to give you an inside view of what it takes to be a caregiver and what it's like to be a patient.
And most of all, we hope you'll maybe be able to play something you hear on here that might help you in your own life. Sometimes life changes, and it's all about how you handle the journey.